Hi, Isa. How are you today?
Good. How are you?
Doing good.
That's good.
My name is Ashley. I'm going to be the nurse taking care of you today. Your doctor asked me to do a head-to-toe assessment on you, so is it okay if I do that?
Mm-hmm.
Good. Okay, so I'm going to come over here and wash my hands real quick, and then we'll get started. The first thing I'm going to do is look at your head and just make sure I don't see anything obvious up here. Everything looks good up here. Nothing out of the ordinary. We did take your vitals when you got here, and your blood pressure was 120/80. Your temperature was 97.6. Your pulse was normal, and your respirations were normal. And your weight was 130, which is all wonderful. Are you in any pain today?
No, I'm not.
No? Good. Okay. And your O2 stat, I forgot to say, was 100%. So that's perfect. That's awesome. Okay. So the first thing I'm going to do is I'm going to look at your eyes. Okay. If I can find my pen light here. And I just want you to look straight ahead. Don't look into the light, okay? And do you wear contacts?
I do.
Okay. Do you wear them all the time?
Mm-hmm.
Okay. When was your last eye exam?
Last March.
Okay. And everything was fine there? Good. Good. Well, your eyes look normal to me.
Okay.
Your pupils react to light just fine. So if you wouldn't mind following this pin for me with your eyes. Wonderful. Okay. And can you tell me where you are?
I'm here at the clinic.
And can you tell me your name?
My name is Isa Andrade.
And why did you come in today?
I have a well-to-do checkup.
Okay. And can you tell me about what time you think it is?
About 2:20.
Okay. Okay. All right. All of that's wonderful. Okay. So the next thing I'm going to do is I'm just going to look in your mouth. Okay. And all I'm doing is I'm just checking for any sores or redness or anything like that. Okay. Everything looks great. And do you wear hearing aids or anything like that on your ears?
I don't.
Okay. Okay. And I'm going to feel your neck. Okay. And all I'm doing is I'm just checking for any distension. Wonderful. And I'm going to touch your face too, and I'm just feeling your sinuses. That's all I'm doing. Perfect. Can you smile for me? Can you stick your tongue out? And can you raise your eyebrows? Perfect. All I'm doing with that is I'm just checking to make sure your face has good symmetry. So I know those are some weird questions, but that's why I ask those. Okay. All right. So the next thing I'm going to do is I am going to listen to your chest, okay? And all I'm going to do right now is just listen for your lung sounds, okay? So I'm going to reach under your shirt. My hands are a little cold, so I'll try to warm them up for you real quick. And I'll try to be quick too. Can you take a deep breath for me? Perfect. One more. Perfect. All right, I'm going to go up under your shirt just so I can hear the bottom of your lungs. Can you take a deep breath? One more. Wonderful. Okay, so now I'm going to listen to your heart, okay? So I'm going to start over here. You can just breathe normal. Okay. And this right here is your pulmonic valve. It's in the second intercostal space. Perfect. All right, I'm going to go up your shirt again just so I can hear the bottom of your heart, or what we call the apex. And you're going to feel me touch your breast. Wonderful. Everything sounds great. So now what I'm going to do is I'm just going to listen to your lungs from the side. Okay? Could you raise up your arm? Wonderful. Thank you. Big deep breath. One more. All right. And I'm going to listen to your lungs from the back of you. And I'm going to just, oh, there you go. Awesome. I'm going to go up under your shirt one more time. Big deep breath. Wonderful. So there's 4 spots on the back that I listen to when I'm listening for your lung sounds. So, okay. So now I'm going to listen to them from this side, okay? And I promise at the end of this, we're almost done with all your big breaths. One more. Perfect. Okay. So the next thing I'm going to do is I'm just going to feel your back while you breathe, okay? Just take one big deep breath for me. Perfect. All right. So the next thing I want to do is I just want to look at your tummy. So would you mind laying down for me? Thank you. Okay, so I want to listen before I do any touching just because I don't want to disrupt any sounds that are already in your tummy. And I'm going to start down here on the right side on the bottom and work my way around like a clock, okay? And I'm just listening for your bowel sounds is what I'm doing. Wonderful. And the goal is to have between 5 and 30 sounds or clicks in your tummy, and you definitely had that, so everything looks normal. So now what I'm going to do is I'm going to touch your tummy and just kind of feel around. And I want you to let me know if anything is uncomfortable or hurts, okay?
No.
Perfect. All right, everything looks great, Issa. So the next thing I'm going to do is I'm going to look at your circulation, okay? And to do that, I just kind of pinch your fingernails a little bit. It won't hurt, but you'll notice me pinching you, okay? Perfect. Wonderful. Okay, and so now what I'm going to do is I'm going to check your range of motion. So I'm going to take your hand and go like this. Wonderful. Other hand. Okay. And so I'm just going to look at the skin on your arms and just make sure everything looks normal. Color is normal. I don't see any swelling or edema. And your skin turgor is wonderful. So now what I'm going to do is I'm going to listen, or I'm going to feel for your pulses on both hands at the same time just to make sure they're the same, okay? Perfect. Okay. So now what I'm going to do is I'm going to move down to your feet. Is it okay if I take your socks off?
That's fine.
And I'm going to do the same thing to your toes as I did to your fingernails. I'm just going to pinch them just a little bit, okay? You won't hurt. Perfect. Your feet are cold, my goodness. All right. So I'm going to feel your pedal pulses, or the pulses that are on your feet now. And just make sure that they're the same. Perfect. Okay. And now what I want you to do is I want you to push against my hand. Okay. Now pull your toes up to your head. Perfect. Push against my hand with this foot. And pull your toes up to your head. Wonderful. All right. And I'm just going to look at your legs here real quick. I don't see any swelling or edema. And the color is normal. Everything looks great. All right, Issa. Well, I think that's all I needed. I'm going to put this information in your chart, and your doctor will be in with you in a little bit.
Okay. Thank you.
Thank you.